Ooh.
Okay. So indication is pneumoperitoneum. You can see there's really massive pneumoperitoneum. Really, the lateral is just unbelievable. Hold on. You can see this patient is floating away, which is not a usual kind of appearance of, and patient is inpatient. So when we open CT, not surprisingly, so it's just massive pneumoperitoneum. Of course, this is Sunday trying to get in touch with somebody from the surgery and trying to figure out like what is ruptured and what can be ruptured that can give you this degree of pneumoperitoneum. So anybody has any thoughts? Or anybody? I've never seen. This is not a new. This is kind of not a novel thing that's happening, but the first time I've seen it on the CT.
No colonoscopy, right? I mean, even that's a lot for colonoscopy, perf.
No colonoscopy, no surgery in the past 10 days.
Huh.
So usually when I see that much air without any fluid and it looks like it's peritoneal, not retroperitoneal, I often think about the stomach.
Yeah, perf gastric or proximal duodenal ulcers are the most common acute presenting things to cause free air without abscess.
Right. So these were my thoughts, and I was hectically trying to get a surgeon on the phone to tell him that the patient perf. I had a nurse who said, "Well, I know that they're doing this intentionally. Notice here, there's a catheter."
Yeah.
Then I started kind of digging through patient's chart, and this is again that generally we don't do routine imaging for, but this is called a progressive preoperative pneumoperitoneum, and this is not a very novel technique. It's been described since now, and it's basically have loss of domain. And so with the surgeons, this little catheter, which you can see here, into the abdominal cavity, and they progressively insufflate the patient. So over the course of a week to 2 weeks, progressively, add air into the abdominal cavity, and the idea is that they stretch the cavity, they stretch the lateral oblique muscles. They also add Botox into the muscles to relax them. And the idea is that eventually the cavity will be accommodating for all the organs to go back. And it decreases the post-op complications, including the abdominal compartment syndrome, including dehiscence of the surgery, and actually improves patients' like respiratory function after the surgery. So I thought it was a very interesting thing. So again, like
impressive.
Say it again.
That's impressive.
Right? So I've never seen free air like from a perf to this degree. I guess that could have been my clue that this is something odd going on. I've seen this much air like after, immediately after laparoscopic surgery where, again, they insufflate the patient. But, I just kept thinking, oh my God, I don't know what perfed, but something perfed really badly. All right, so my third and final case is a